Shalom. Welcome again to Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. I'm your host, Rabbi Richard Address. Thank you very, very much for joining us. As you know, we try to explore aspects of things that are impacting our own longevity and the impact of those items on our community, our families, our congregations, etc. In this very interesting longevity revolution that we're living in. Part of that revolution, part of the changes, part of our own journey here has to do with our interaction with our physicians. And as you know, as we get older, there's a somewhat tendency to perhaps deal with physicians and doctors a little bit more than maybe we did many, many decades ago. One of the interesting conversations that I've had with some people is the idea of the intersection or possible intersection of spirituality and medicine and medical training. And for that, and to carry on that discussion, we are very, very pleased to welcome Dr. Skrzynski, who is a local doctor here in southern New Jersey. And from full disclosure, wrote a very, very interesting thought piece for the website, JewishSacredAging.com, on the intersection of Judaism, medicine, and spirituality. And we invited Adam to come back and have a little bit more of an in-depth conversation person to person. Adam is a Detroit native and an infectious disease physician practicing back here in southern New Jersey. He's a member of a synagogue board of directors and also on the board of the directors of the Society for Humanistic Judaism. More importantly, he's got a great family. And his wife is also a physician and 3 very lovely daughters, which will drive him crazy. He doesn't know yet, especially when they get to be teenage girls. Just buckle up, because that is another experience that just lean back and enjoy it and have your credit card handy.
Point noted.
Point true. Adam, welcome. Welcome to Seekers of Meaning. It's really nice to see you on the Zoom machine. We've seen each other and in person. So let's get right to it. Give me the theme of what the emis of what this article that you wrote for the website, which has gathered some significant response.
So, I've always been very interested in the intersection between medicine and spirituality. It's been an interest going way back, and my Jewish background is also very, very important to me. So it was very an easy kind of connection for my mind to make, to say, well, how does that intersection between Judaism and medicine relate to what I do on a daily basis, and how can it improve what I do on a daily basis? And obviously, Judaism has such a wealth of information regarding health and medicine, and some of the great Jewish sages and scholars of all time had connections to medicine, perhaps were physicians. So the article really sought to lay out kind of a groundwork for potentially using Judaism and principles of Jewish healing to address issues in medicine that I think have come up over time, and especially I think in recent years since the COVID pandemic. I have found in my practice that there has been really, I think, a loss of trust in our medical system, in not just on a physician basis or a practitioner basis, but up and through government policies, things we typically take for granted as great life-saving measures, such as vaccination, public health measures, that all got very much distorted, I think, by COVID, but I think that was all brewing before. And I think that the other point I mentioned in the article, the corporatization of medicine. I've always had this framework in my mind where I differentiate between the profession of medicine and the healthcare industry. And I think those are two distinct things. I think one is much more a sacred calling, hence, in my mind, the connection to spirituality. And the other is much more an industry, a economic field where we see playing out, mergers and acquisitions, the economics and financials of healthcare play out, insurance and those issues come into play. So as physicians, I feel like you really have to walk this tightrope. And I turn to Judaism as a source of inspiration to be able to do that, and as a way to perhaps connect better with patients, whether they're Jewish or not. I think that these principles really can help people. And the other side of it too is, in healthcare, especially since COVID, but this was going on a long time before, there is this phenomenon of burnout or disillusionment. I heard it best described, and this is not my own original phrase, but multiple other physician speakers that I've heard have used it, but moral injury. The concept that as a physician, you're kind of trapped in a system that really does not allow you to be as ethically whole, as, I guess, spiritually whole, and as morally whole as you could be if you weren't in between all these competing interests. And so I think that Judaism is really a potential answer to that. There's such a rich tradition of dealing with many of these issues.
So how would you do this? Patient comes in, sees you with a presenting issue. Is there, by definition, probably nervous, a little stressed, concerned? Your role is to analyze, test, diagnose, treat. And what point along this continuum, and I understand that in certain systems, there's a time pressure. How do you incorporate what you're calling spirituality, which is a very, very open-ended term and very personal? My spirituality may be very, very different than your spirituality, and very, very different from the 16 other people in the waiting room. How would you do that practically? I mean, you're certainly not going to say, let me begin by quoting the Torah.
Yeah.
So how would you do that?
I love that you brought up this idea that of the differing spirituality, that everyone has their own way of approaching that. And I think that there are some circumstances that may not be applicable here. If someone's coming in with a cold and they just want a prescription for a cough medicine or something. I mean, but there are many situations where people come in and there's a great deal of fear and anxiety, and the stakes are very high. I mean, I personally treat HIV patients, and so this comes up a lot. And almost the first question they all ask is, am I going to die? Like, when am I going to die? And this is kind of outside the sphere, but in HIV now, I mean, this is a chronic disease. I mean, people live normal, healthy lives, and so. But what I see that as almost a spiritual crisis. Someone's coming in with this existential thought that they're going to, as a result of having this disease, as a result of whatever led to them being infected, have their lives taken from them. And I think that when you look at how different people come in, as you said, the question might be the same. Am I going to live? How long am I going to live? But the way they approach it is different. So I think the art of medicine is identifying that in people who need it. Again, it's not every interaction. It probably can't be every interaction, but when it's appropriate, I have found that if you give people that space in the room to speak, and it doesn't have to be an hour, it can be a couple minutes, that you can really hone in on what that person needs, from you as a physician. I mean, this is, outside of the medication you're going to prescribe or the labs you're going to order or the x-ray you're going to get. So I think it really comes down to a lot of listening. And I found that and this was, teaching medical students this idea of open-ended questions versus closed-ended questions. And there's a big fear in medicine because of the time constraints that you're going to lose control of the room and you're going to be behind and people are going to be mad. But in my experience, and I think it came with experience because, over time I've gotten much more comfortable just listening to people, but people tend to tell you what you need to know, not only in terms of the biomedical side of things, but also in terms of the spiritual side of things, that they'll tell you something, that you can supply that empathy that will give them the strength to continue onwards. And again, I think it's different for every person. Everybody brings in a different background, whether religious, non-religious, secular, atheist, believers. I have patients who talk openly of God, but I have, Jewish patients, Christian patients, Muslim patients. There are those who, have passions like sports or music, so that can also be part of it, anything that provides that spiritual context. So, at the end of the day, I think a lot of the medical interaction comes down to reminding people of who they are. They come in, they think they've lost something. Say they have HIV infection, right? That's a fundamental change in your life. You can't go back. But you can also give them the sense that although this part of their life has changed, they still are fundamentally the same person. They don't have to give up this core part of themselves. And that they do have some semblance of control. I think a lot of the fear in the medical interaction too is that you're coming into this place. There's all these technologies and terminologies and Latin and Greek terms being thrown around, and these medications that if you read the package insert have 50 different side effects in the clinical trials, and it's terrifying. So I think that the job of a good doctor is not just to treat the disease, but I addressed this in the paper too, this differentiation between illness and disease. And this was something I'd read from Arthur Kleinman, who's a psychiatrist and medical anthropologist at Harvard. And it really stuck with me. This was in college, I read this. And the idea that the disease is the HIV, is the whatever, and you can treat it, you can cure it, but the illness is the subjective experience that the person brings into the room with them. And I don't think you can address the illness without addressing the spiritual aspects of someone's life in whatever form that is. Again, it's not going to be, as a physician, you're not necessarily a chaplain, you're not a rabbi, you're not a priest, but you are someone who has been given a very intimate glimpse into someone's life. There's very few jobs or professions, I think, where that occurs. And I just find that if you use that information skillfully and you really tune in and intuit what that person might need in terms of whether it's empathy or whether it's just that companionship, some medical visits end up being social occasions, people, so I think that, as I said before, I think it comes down to listening. I think it comes down to really listening to somebody.
It's interesting. Maimonides, who is one of the classic exemplars of this combination of the spiritual and the medical, is a practicing physician, wrote extensively on medical issues. Also one of the leading Torah scholars in the entire history of Judaism, 12th century. and he wrote in one of his writings about when a patient comes to him, what the physician should do. And it's a glimpse when we teach this workshop on health and wellness in Judaism. It's a glimpse into Judaism as a holistic medical model, that this intersection and the interconnectedness of the mind, the body, and the spirit. And this may not be practical, as you just alluded to. He basically says, when your patient comes into my office, I try to examine, before we deal with the medical, before we deal with why you've come to me, we have a conversation about the person's, where the person is in their life, what stresses, how are things at home, how are things with the children, how are things with your boss, have you been feeling this way, that way, stressed out. And only then, he says, after I've examined the psychological state of the patient, can I deal with the physical state of the patient? Because he says one thing a lot of times interfaces with the other and is a cause. If I'm having stress at home, I may have GI issues because I'm repressing all this stress. So just give me a pill. But the pill isn't going to solve the problem. I guess it's your choice between the illness and the disease. But as I've had physicians in classes tell me, that sounds really great in the 12th century. It doesn't work in the 21st century. So the question goes back to, well, how do you begin to do this? Two, how do you begin to teach this in medical schools? And how do you guard against, because this comes up also, certain physicians who will politicize and proselytize. So, for example, I'm a 17-year-old young woman who's pregnant, but I want to terminate the pregnancy. And I'm sitting with a physician who is basically anti this. And is there a danger that I'm going to lecture her instead of treating this person, politicize it? So how do you handle all this in this ideal?
Yeah. I think taking the last point first, I think that is a danger, right? And I think that you have to come at you have to come at it non-denominationally and without the idea that you're looking to gain something from the interaction or impose your beliefs. And I think that does happen, certainly. I've heard stories and seen it happen. I think that's just inevitable that doctors are going to put their personal lives in front of that. The idea of involving spirituality in the medical encounter, to me, needs to have those ethical boundaries. And I think one of those is drawing a line at, attempting to proselytize or convert or impose a religious belief or doctrine that would contradict the scientific or medical accepted practice. To me, that's where the line should be drawn there. In other words, if a certain treatment is medically indicated, is scientifically valid, then no matter your beliefs, there's that ethical boundary where you're obligated to offer it. I really believe that. Teaching this stuff is difficult. And I've had experiences where there's a lot in terms of medical humanities that's taught is how they term it in medical schools. And it's great. But I think universally, and I have this reaction too. I'm not immune to it. It's the idea that, oh my God, it's one more thing I have to do. And it's, and it's the sense of impending doom that comes over people. So I think that just reflects that there's a problem with the system, because I think that is such a fundamental part of it, right? So I think there's 2 points here. There's two different things going on. I think that kind of the Maimonidean way of doing things would be awesome. And I'll tell you why. I think not only would it benefit the patients, I think the physicians would get a lot more out of what they do every day. I know I would. And I think that's why I pursued this line of questioning, because I've certainly been in that boat of feeling burnt out, of feeling that I was just part of this giant machine that was churning and churning and churning. And that's what healthcare can feel like sometimes. So I actually think that those pieces would actually improve morale amongst physicians, which is a big problem these days. How to implement it without being totally overwhelmed. I think that, and this is not an answer I have, but the system needs to be reformed. I mean, the system needs to change. And there's so many different interests in the system, and so many of them make so much money or invest so much time or effort or have so much political power or academic or scientific power in the system, that it's almost impossible to move this in any meaningful way unless, and this is my opinion, unless you really just overhaul it from the top down, but short of that, I find things like, writing down in my progress note, something personal that the patient tells me about themselves. So the next time they come in, I remember to ask them about it. Things like that. I have the luxury of seeing people at least twice a year. That's for HIV, how the care is done. And so those longitudinal relationships, even if you don't have all the time in the world, one day you start learning, really a lot about people over the course of a couple of years. And I've found that, even if it's in drips and drops here and there, it does add up. It does make a difference. So in terms of teaching students to do this, it's going to be a challenge, because I think medicine is heading in an even more technical direction, right? We're going to have AI. We're going to have robotic surgery. We're going to, more and more robotic surgery. We're going to have, computer algorithms and AI replacing people, doing radiology or doing this. It's probably going to continue down that path. One of the benefits of that, I think, though, will be that AI is the real potential to free up your time, right? If AI can write your progress note, or AI can do some of this other stuff, maybe that's a good thing. Maybe that's the other side of it, that even though it's more technical, it gives us time to be more human. And yeah.
So, I mean, all of this, in a sense of looking forward, I'm going to bring it back to like right now. Now, I know there are a couple of institutes out of universities and hospitals that are dealing with this intersection of spirituality and medicine and aging. Duke, George Washington University, GWISH, some stuff at Stanford, some other places that are looking to this. It's more medical models right now than spiritual models, although they're trying in various locations. Instead of reforming the entire system, which may be a little bit overwhelming right now, let me ask you, how would you begin to change the culture, let's just say here or at your hospital? Do you think that if you offered a conversation for physicians, nurses, etc., on spirituality, whatever that means, or how to bring one's own sense of existential reality into the practice, do you think people would want to attend that, have a conversation about that?
I really do, actually. A lot of health systems nowadays do a lot of quote unquote wellness stuff. They'll teach meditation or yoga. But there's also been an increase too in, I would say, kind of a non-spiritual approach, but in terms of like group therapy or individual psychotherapy offered. I think the spirituality piece, I actually think that would be even more even more popular, so to speak. And you said something very interesting, that it allows you to bring yourself into that room. And I think that having these discussions about, not just HIPAA and ethics and customer service and this and that, but to actually speak to people and say, why are you doing this? Because a lot of people got into a healthcare field, a medical field, for a reason, whether they had an experience or they're, trying to improve the world. So I think people who come into healthcare and medicine are already somewhat aware of their own spiritual needs, of their own spirituality in general. And I think if you can talk to people and ask them to identify those parts of themselves that want to bring a spiritual dimension, that can start coming out. And again, it doesn't mean proselytizing. It doesn't mean bringing any specific religion to the picture. You can be inspired by whatever religion or tradition you want to look back on, or even if it's your own creation. But I think that having sessions where we can be reminded as healthcare people why we're doing this, what in ourselves is lifted up and enlightened by this work, because that's what I find being buried by a lot of the other stuff. I do think people would respond to that. And another word that comes to mind when I think of medicine is sacred. I think that that there is something sacred about the interaction that occurs, and we forget that. It's not part of our training. It's not part of our everyday life. It's nowhere on the patient satisfaction score that we get. But I think people who are drawn to this field, I think a majority of the people in this field are drawn to it because it means something more. It's a calling. So reminding people of that and working with that, and it's interesting because I think there's some crossover to, although you wouldn't have time to be a chaplain, but there is some crossover to that idea of chaplaincy, of attending to the patient and really getting back to, I think, a very kind of primal core of what medicine is. Historically and prehistorically, I think many of the physicians practicing whatever medicine we had at the time in prehistory and the Paleolithic, they were also the spiritual leaders, shamanism and the idea of being a bridge to that other world and healing in the process. So I think if we were to tap into that, I think that we have this innate biological need for that sense of awe, for that sense of spirituality, and many patients would pick up on that. I think that it would be a totally different feeling. Everyone's going to have their good days and bad days, but if you remind people on a daily basis, I could just imagine that there would be other aspects that they would bring to the encounter, to a patient encounter.
Well, not only the patient, but I think equally important, as you alluded to the physician themselves, because it's easy, even in the rabbinate, it's easy to get lost in the data, in the weeds of the daily day. And sometimes it's necessary to be reminded that this is a calling. There's in the class that we teach on this, there's a physician's prayer that was allegedly attributed to Maimonides, but it was not Maimonides. It was written by a physician in the 19th century. But he talks about this linkage to what I'm doing is something sacred. And he writes that if anybody comes to me, just remind me that these are human beings, creations. He says he uses God language, created in the divine image, but they're human beings, each carrying a universe of hopes, dreams, fears. And so I call this sometimes with the theology of accompaniment. Because what a chaplain does, we just had this conversation with a group of chaplains in Milwaukee. What a chaplain does, what you do with your patients, okay? In many ways, you accompany them on the journey. And a medical journey, we'll do it on a religious or spiritual journey, but it is in essence a theology of accompaniment. And that changes, I think, the dynamic. If you're accompanying somebody, you're holding their hand, you're accompanying them, you're being with them. So this idea that you're playing with, I'm very anxious to see, and I thank you, because we're running out of time. I congratulate you for thinking about it. I'm very anxious to see what the next steps are. And for full disclosure for the people who are listening or watching this, Adam and I live near each other and we're in the same congregational community. So we're going to try to put some ideas together. I'm inviting you to write some more for the website, because I think you're tapping into something that I think people and physicians and nurses, because you can't forget nurses, because they're also involved in this. Because if we allow people to understand their own humanity and their own fragility and their interconnectedness, we all may benefit from it. So Adam, I want to thank you very, very much for agreeing to just talk some of this out. And if those of you who are listening or watching this have an idea or a reaction to this, please email us. We're very interested in your reaction. Just email me at the website, Rabbi Address at JewishSacredAging.com. That's Rabbi Address at JewishSacredAging.com. Use that same address for any other idea or suggestion for Seekers of Meaning. Hey, Adam, thank you very much. I will see you in shul, if not before. Say hello to the family for me, will you?
Will do. Thank you so much for having me.
And lots of ideas percolating. We'll meet at that diner, South Jersey. We'll meet at the diner and talk about next steps. To all of you again, thank you very, very much for joining us in this, what I hope is a conversation that triggered some ideas in your mind. And again, just email me back at rabbiaddress@jewishsacredaging.com to let me know your thoughts. Seekers of Meaning is produced at the broadcast centers of Lumetkin's media companies in Cherry Hill, New Jersey. And a huge shout out to our producer, Steve Lubetkin. Till we meet each other again on the next Seekers of Meaning, please stay safe, everybody. And most of all, be kind to one another. Shalom, Todah.